One very important aspect about performing endovenous laser ablation procedures is that it is ultrasound guided. So in this particular course, we have an animal tissue model wherein the vein is harvested and the candidates will be performing the procedure in the animal tissue under ultrasonography guidance. Now that is very important. It's easy to see and take a puncture in the vein, but it's quite difficult when you are doing the procedure as you are looking at the sonography screen. Endovenous laser ablation procedure has to be performed under ultrasound guidance, and this is where this course will really help you to build that, will introduce you to how to go about this entire thing. Apart from this, we also have a phantom limb model wherein before they do the endovenous laser ablation procedure, they will be practicing IV puncture on the phantom limb again under ultrasound guidance. And the foam sclerotherapy part. Now we know that foam sclerotherapy is a very essential aspect of managing varicose veins. And Professor Malay Patel, who is a senior endovascular surgeon, has done some pioneering work in this field, and he himself will be dealing with the topic, how to prepare the foam using tertiary technique, the nitty-gritties of it, the nuances of it, and they will be putting the foam in the vein as well.
I will be there to show you ultrasound guided chemical endoablation with sclerosant foams. And actually, I would show you how to access the vein, inject, and wait for an outcome, how long you have to wait, what would be your complications, and what to anticipate. Let's embark on this journey of learning together.
So we are trying to make sure that the candidates get a very realistic experience, which can be later put on, they can develop on it in their practice, thereby helping you to manage your patients better.